studied for Nclex today? Have you studied for Nclex today? Well, I hope that you have, but guess what? If not, join me. My name is Regina, MSN RN, and I'm here with RemarNurse.com, and we are on a 30-day Nclex challenge. And this is day number, do you know what day it is? We are on day number 8. That's right, 30 days, nothing but Nclex every day. I'm coming to you from my Nclex review program, the Nclex virtual trainer. That's right, we are going over all the major themes that you are learning in your Nclex VT workbook. Also, I am reviewing quick facts with you, making sure that you know what you're supposed to know. This is 30 days of Nclex. If you are a nursing student preparing for the Nclex exam, this year is your year. This year is your year. Hey, everybody, we are doing it big because we want you to have your nursing license and become a Remar nurse officially with those big letters RN or PN behind your name. And so, for 30 days, that's right, we are actually in the Nclex VT, and we are on week number 2. We are on week number 2, guys. So check this out. A lot of you guys started with me last week, and it's okay if you didn't get in day 1 because we have these videos rolling. We had the rest days built in, so you can still get started and join right now. But listen, we know the books are coming. Some of you are ordered last week and you're still waiting for your books. USPS is slow right now, and there's nothing I can do about it. All right. I sent off a card and it literally took like 15 days to get there. So you guys know what time it is when it comes with the books. But if you have your virtual trainer, don't worry. There are things for you to get done while you're waiting, and you can always join in with me here. Shout out to Miss Billie Jane. She says, oh, I missed this. Hello, Regina. It's nice to be here. Remar Nurse, class of 2018. I love it. Thank you for popping in and just giving us motivation. We want to be like you. How good is nursing right now? So we are on a mission, and I am about to do some practice questions, some major themes from day 8. Now, if you're following along with me, this is the week 2 calendar. It's in the file vault. If you haven't printed it out, please do so. We also will be putting a link for a sign up to get this, and we will email this out to you if you sign up as well in the video description. Okay. So for today, we were supposed to study quick facts, pages 11 to 20. Did you do that? All right. That's part of today's assignment. And again, I'm reading it from our study calendar, and there are times listed on the study calendar. You guys will see there's times listed on the study calendar, but the times are just my suggestions. Like today, I didn't even follow the study calendar times because I got a late start. So I didn't start studying until 10, but I did study according to the schedule. So quick facts, pages 11 through 20. I did that. Woo! Completed the maternal and child health progress exam. Did you do that one? It was kind of difficult, but I got it done. Watched age-specific nursing care. I watched it. Did you watch it? All right. And I love that video because I just love seeing the different age groups. All right. Shout out to Kathy who says I did. All right. And then in the back, studying the quick facts, because remember, you're studying the front of quick facts, which is the content. And then also we have to study the back of quick facts, which is the pharmacology. All right. So today in the back of quick facts, we actually did the, I'm not even going to tell you what we did because I'm about to quiz you on it. So I'm not even going to tell you, but we did pharmacology in the back of quick facts. Liz says, I do 4 or 5 pages daily. That works for me. I like that suggestion. I think that's cool. Not doing too much. Because I've read this book so many times, I can't say, like, I usually do about 10 pages, but I've been studying this book literally for years. So for me, it's a little different. Okay. So those are the things we were supposed to do today. And then after that, your study session is over until tomorrow. So I'm coming back on here today to go over the major themes with you guys. Let me get my notes together here. If you want to join, I see a couple questions. Just go to remarnurse.com and you can find all of my products and the VT and all those things. The coupon code for this week is INVEST. Okay, INVEST. All right. Now, let's go over the review for today. Remember, today's lessons were wrapping up maternity, age-specific nursing care, and then the pharmacology in the back of Quick Facts, as well as the 11 through 20 in the front of Quick Facts. All right, so here we go. Here's the questions, 11 through 20 for Quick Facts. All right. Here are the questions. Go ahead and put the answers on the screen. This is also Monday motivation. This is Monday motivation. We're doing how to pass Nclex all right here. We're on day 8 of our 30-day challenge. Here are the answers. All right. First question. And I'm mixing them up. Don't ask me what the page numbers are because I literally was pulling questions during my study session, but it comes from today's lesson on the calendar. So the first question is, do the elderly, are you guys ready? Put the answers on the screen. Do the elderly have more fat or protein on their body? Do the elderly have more fat or more protein on the body? All right. All right. Your books are coming to you. That's what I can say. United States Postal Service right now is in the midst of something special right now. And so they're coming as fast as we send them out. Then once they're in the hands of the United States Postal Service, we just have to watch the tracking. So you guys will get tracking from Regina, and then you will be able to watch your books, okay? All right. Fat or protein on their body. Ooh, I see the answers. I see people saying that they have more protein. They have more protein. All right. All right. The correct answer, the question from our study session today, do the elderly have more fat or more protein on the body? The answer is more fat. They have more fat on their body, less protein, right? Not muscles, not a lot of muscles on the elderly. So the reason why this is important, because one of the themes is the elderly can have problems with drug accumulation in their body, right? Their body holds on to medication, it settles into the fat, and they keep it. So we have to be very mindful of how much medication we are giving the elderly. Good job, guys. All right. Next question. This is a good one. Immediately after death, should the nurse clean up the body first or allow the family to visit? Nclex critical thinking. What do you guys think? Immediately after a patient dies, should the nurse clean up the body first or allow the family to visit? All right, here we go. All right. Here we go. Go ahead and put that answer on the screen. It's a critical thinking. I know you guys haven't been in the situation probably, but what do you think? Based off of your nursing knowledge. All right, here we go. I see clean up. I see let the family visit, allow to visit. All right, I'm glad you guys showed up today. We are studying. This is day 8 of the 30-day Nclex challenge. My name is Regina Callion. I am so happy. To be a registered nurse. I have my master's. I have like this wonderful community called Remar Review, and you're a part of it right now. So I see the answer. I'm going to give it to you. The correct answer, the question was, again, after a patient dies, should the nurse clean up the body or allow the patient's family to visit? The correct answer is clean up that body first. Yes. Why? Why should the nurse clean up the body before allowing the patient to visit? I could think of so many reasons, but I'm sure you guys can too, right? Go ahead and put the comments on the screen why it's more appropriate to clean the body than allow the family to visit. All right. Woo! Because number one, you need to remove all of the IVs, all of the oxygen, all of the drains and dressing and things like that. All right. And remember, it's not what you do in the real world. It's not what they do at the hospital. It's what you do in utopia, right? Which is the Nclex world. And the reason why, number one, you do Patients who are expired, what happens to their bodies once they are expired? They begin to harden, right? They begin to harden. Rigor mortis sets in. They get stiff. They get rigid. So, yes, of course, there's a presentation. You want the body to be presentable, right? You don't want the patient to see the body however it expired. I mean, when you expire, you usually lose control of your bowels, your bladder. If you had to have chest compressions or some kind of invasive anything, that needs to be, that needs to be cleaned up before the family sees you. Just not sees you, sees the patient before, just before the presentation. But also rigor mortis sets in. And so if the patient needed to have dentures in their mouth, once rigor mortis sets in, good luck getting those dentures in. All right. They're going to be very, 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 very tough to do. All right. And so there are things that we can do as nurses before we let the patient's family know that they, that they have expired. All right. So you want to definitely have that in mind for Nclex. Okay. All right. The next question, what kind of medication is losartan? Moving on, what kind of medication is losartan? Let me know what kind of medication losartan is. All right. Hello, everybody. Hello. Come on in. We are studying. We're in the midst of a study session. This is day number 8. I'm asking, what kind of medication is losartan? Don't cheat. Either put it on there or say, I don't know. What class of medication? All right. That's what I'll say. What class of medication is losartan? You got it. I love it. It is an angiotensin. Yes. Receptor blocker. We studied this in the quick facts today. It was part of our pharmacology. So I'll ask you this. What 2 things do angiotensin receptor blockers help the kidneys to excrete? What 2 things do ARBs, we'll call them ARBs for short. What 2 things do ARBs help the kidneys to excrete? What saith you, Remar nurses? I want to hear it. This is the day for comments. All right. We're helping the kidneys to excrete. Yes. And ARBs are to help us with hypertension. So yes, what 2 things they help the kidneys excrete? Sodium. Yes. And water. Yes. Great job. That's what they do. That is what they do. All right. But don't be cheating. I don't want you to look into your quick facts book. I want you to try to think. All right. That's the goal right now. Question. Here's a question. The next question. Can clients who are pregnant take angiotensin receptor blockers? What do you think? Whew. All right. Can clients who are pregnant take angiotensin receptor blockers? What do you guys think? Yes or no? Maybe so. Yes, no, kind of, maybe. The correct answer, you guys have it. Comments on the screen. The correct answer is no. It's a negative. It's a negative. And if you guys are not familiar with this content, you got to get your virtual trainer and you got to get your quick facts. Okay. Get your virtual trainer and get your quick facts. All right. I am moving on. This is how to pass Nclex. Yeah. All right. Next question. Oh, do mydriatic medications constrict or dilate the pupils? Do mydriatic medications constrict or dilate the pupils? What do you think? All right. What do you think, guys? And this is about you showing up and giving it your best. This is day number 8. We are trying to be consistent because you feel so much better. You feel more prepared for your license when you know the content. All right. Feel more prepared. All right. And this is not only on the test, but in real life as well. All right. Dilate or constrict, you guys got it. Those medications, they dilate the pupil so that the physician can look behind the eye. All right, behind the eye. Next question. I got to wrap it up with maternity. So the question for this this one is this. Do we administer RhoGAM to the mom who is Rh negative or Rh positive? Question, do we administer RhoGAM to the mom who is Rh negative or Rh positive? What saith you guys? Welcome to the 30 Days of Nclex Challenge. You are in the middle of day number 8. Study session is day number 8. What do you guys say? All right. Yes. All right. You administer it to a mom who is Rh negative. Awesome job, guys. Awesome. I love it. I love it. Rh negative mom, Rh positive baby. Yes. Okay, here we go. Do oral contraceptives increase or decrease estrogen levels? Do oral contraceptives increase or decrease estrogen levels? What do you guys think? All right, there's over 500 nurses right now studying with me. This is insane. On a random day, we are preparing for our nursing license. You're never alone, okay? You're never alone. I love it. I love it. The question was, do oral contraceptives increase or decrease estrogen levels? The correct answer is increase. Increase, guys. Yes. All right. Next question. What does epoetin alpha stimulate the body to make? Hey, what does epoetin alpha stimulate the body to make? Also, if you want to sign up for the calendar, get the calendar, click on the link in the video, and you will be able to get that calendar. Yep. I want you to join me. I want you to be excited on this challenge and have everything that you need to take the next step. It's time to get your license. This is your time. Epoetin alpha. I got it right from the content that we reviewed today. Did you study this? They are used. Epoetin alpha is a medication that's used to increase red blood cells. It's used to treat anemia. So it stimulates the bone marrow to produce red blood cells. Did you know that? And I love it. Some people are just like keeping it real. I don't know. I have no idea. I don't know, Regina. And that is another part of the studying process. If you can admit you don't know something, then you can take steps to correct it. But if you're sitting there and you're like, oh yeah, I knew that, and you got it wrong, you didn't know it. So you're going to go back and study. All right. I want testimonies on top of testimonies on top of testimonies. That's all I want from you guys. All right. Okay, here we go. Next question. Is a milky white lens seen in cataract or glaucoma? Is a milky white lens seen in cataracts or glaucoma? What do you say? What do you guys say? Do you know the difference between cataracts and glaucoma? All right. If you don't know the difference, it's okay. You still have time before your exam to get into your REMAR review. That's it. All right. So we're talking about a milky white lens. Is it seen in cataracts or glaucoma? All right. Click on the link if you want to get the study calendar. It's very easy to do. All right. Very easy to get the study calendar. We're on week number dos. Can you see week number 2? Week number 2, all in blue. We're there. The correct answer is the milky white lens is absolutely seen in cataracts. All right. Cataracts. Yes. All right. And this is it. I'm wrapping it up, guys. The major themes of our studying today. The final question is this. Clients with uremic frost should wash their skin in what? With what? That's what I should say. Clients with uremic frost should wash their skin with what? And this is how I love to study with the quick facts. I love to just grab a friend, grab Mark, grab the kids, grab your mom, it doesn't matter, and have them ask you questions from this book and also this book. And this is how you know if you know it. If you're put on the spot and you actually know the answers, then you can be pretty confident in your studying. All right. So I know everybody has their own special way, but this is my favorite way to interact with this material. All right. So clients with uremic frost should wash their skin in warm water, plain water. All right. And if you don't know why, look it up. Okay. All right. Okay, guys. So that was our review for today. The major things. Tomorrow, I'm going to let you guys go because you have stuff to do. I know you have work to catch up on and you have to prepare tomorrow. According to the calendar, the study session is 2 hours and 45 minutes. You can break that up if you want to do some earlier in the day and some in the evening. But we need to, we're going to need to watch the, we're going to need to do the clinical judgment activities, the physiological changes homework, lots of homework tomorrow. We need to do the quick facts exam, pages 1 through 20. The quick facts exam, pages 1 through 20 is challenging, okay? Have your quick facts there. I don't care. I mean, you can do it with your quick facts. You can do it without your quick facts. The virtual trainer is not going to let you proceed until you get a 95%. So understand that. All right. You have to do the physiological assessment progress exam. All right. So you have to do the homework and the progress exam tomorrow. You get to take a break. Then you go over diets and you do quick facts pages 21 through 30. So tomorrow is intensive. We will probably be spending a little bit more time together because there is some things that I don't want you to miss. Yes, this is all about investing in you. I'm taking time out to make sure that if you're studying with the #1 Nclex instructor, you have the #1 Nclex instructor. What's the point of buying a resource and you never hear from the teachers? The teachers don't care. All right. I care. All right. So I want to be here with you every day. 30 days Nclex challenge. It's not too late to sign up. It's not too late to sign up for it. All right. We are going hard. Yes, this is Monday motivation. Motivate yourself to get that study calendar going. Print it out. Go to remarnurse.com. If you haven't purchased the virtual trainer, use the coupon code. INVEST. We are investing in ourselves. All right. So we back at it. Oh, guys, I want you to get your license. I can't tell you guys how much I love you and I want you to get your license. I love studying with you guys, but I don't want to be studying with y'all when the spring comes. I need to have a whole new group of nurses ready and willing. All right. You guys will have your license and this is part of the journey. All right. The pages for quick facts were 21 through 30. All right. But remember, you're going to take the quiz on quick facts, pages 1 through 20. All right. And then the quiz is 21 through 30. So if you have questions about those topics tomorrow, bring them, because I will only be going over those questions so that we stay on topic. Support at remarreview.com if you want to get your VT renewed, if it expired, anything like that. Team Remar can help you. All right. Let them help you. Send them a quick email. They will get back to you. I promise. All right. It is the Monday motivation day number 8. All right. And we are in it to win it this year. You guys know what we always say. All right. You can, you will, and you must pass Nclex. Make it happen. Woo! You guys did great today. Thank you for showing up and answering those questions. They were tough. All right, so I will see you guys on the other side of day number 8.
This is Nash. Today I'm here to give my testimony how I passed my Nclex using the virtual trainer and the quick fact book. I used the quick fact and the virtual trainer for 4 weeks. I focused and I read this book cover to cover. This is a lecture book that you fill out. There's a homework. Also, this one comes with 6 weeks calendar, but I did not use that. I used 4 weeks and focused. That way everything will be fresh. I did not struggle through the questions because I needed what I got from the for the Nclex, from the virtual trainer and the quick fact. Everything I read was there. I just want to say thank you to Regina and Mark. God bless you for being there, for encouraging us, for building our confidence. I also used to go to Monday motivations that will give me like boost, like motivated the whole week. I really thank you. If you want to get this, I really encourage you to get it. It's not a lot of money. You can pass it, your Nclex, whether the first time taker, second, 10 times, it doesn't matter how many you have taken it. Once you take this class, this virtual trainer, you'll pass it.
The Nclex Virtual Trainer is the best training system for nursing students who need to pass the exam. My name is Regina Callion, MSN RN, and I have helped thousands of nursing students pass the Nclex exam with my program. You're gonna love it. With my Nclex review, I'm going to give you all of my nursing content in one place. Not only that, I'm going to make sure that after every individual lesson, you know what is most important. And if you need questions to help you, I have the questions right here. So what I'm going to do is I'm going to give you an amazing opportunity to get in the virtual trainer. I'm also going to send you the virtual trainer student workbook, as well as my quick facts for Nclex. This is it. This is the opportunity that you've been waiting for. Click the link below. This is the #1 training system for nursing students who need to pass Nclex. Don't miss out on this opportunity. Click the link below. Hey, what are you waiting for? I want to see you on the inside. This is the opportunity. You don't want to miss it. If your nursing license is important to you, you will take action right now. Let's click the link. Let's go.